always good at taking care of people. When I had my little puppy and he was sick, I used to take care of him, and I used to like seeing the nurses in the white, and I thought the white looked nice. So I was like, okay, I'll be a nurse. So proud because my sister, she tells everybody, oh, my sister's a nurse. My mom, my daughter's a nurse. So it doesn't really affect us much because they understand the importance of my job and what I do. From when I was in school, I've had several patients who have expressed their gratitude to me and their relatives also, saying that I took good care of them and I was so nice to them and respect them. They really appreciate that. And for me, honestly, just somebody looking at me and saying thank you for helping me or thank you for taking care of me, it fills my heart a lot, honestly. Like, it really makes me feel good to know that I made a difference in someone's life. So that for me is a big plus. It is very rewarding to help people and to help people get better and to just see the smile on the patients' faces when you help them. It is very fulfilling as well, and definitely job security is a factor and it is important because I just believe as long as you have the drive and you want to and you have the knowledge and the language, you can go anywhere in the world and have a job as a nurse. The world will never not need nurses.
In Office with Dr. Jevon Samuels.
Welcome to another episode of In Office. I am Dr. Jevon Samuels, and today we'll basically be looking into the life of a registered nurse, and she's actually a nurse here in Jamaica, and for privacy reasons we're not going to disclose her name, but she's willing to share with the public. Alright, let us give a brief overview, even though my guest here will give more insight into what nurses do. A registered nurse is part of a healthcare professional. They work closely with the doctors, the surgeons, and other members of the healthcare team, right? And they are normally persons that are very hands-on with the patients. So in terms of administering medications, they do several procedures such as dressing, passing NG tube, and lots of stuff that we'll get into later on, right? But in general, even though nursing is a profession that is in high demand and it has job security both local and overseas, it also have the disadvantages which we will get into, such as long working hours and sometimes short staff, etc. But stuff like issues like that is not really unique to Jamaica. It's a worldwide problem where we have staff shortages, because I'm in dialogue with some nurses that used to work in Jamaica and now they are working overseas, and the short staff and long work hours is not unique to us in Jamaica. So without any further ado, let's get into the discussion to understand what nursing life is like in Jamaica, so students or persons interested in becoming a nurse can have an idea of what it is like from a person that is actually living experience. Alright, so Miss Registered Nurse, welcome.
Thank you. Hello.
Alright. Now, what was the initial reason why you wanted to become a nurse?
Okay, so from I was younger, I was never good at math, right? So when I was thinking about things I wanted to do, I was always good at taking care of people. When I had my little puppy and he was sick, I used to take care of him, and I used to like seeing the nurses in the white, and I thought the white looked nice. So I was like, okay, I'll be a nurse. So that's where it started from.
Alright, good. So in terms, I can tell the viewers, what are some of the subjects that you took in high school or college to matriculate into nursing program?
So as far as I'm aware, there have been some changes from when I started nursing school. So I have 10 CXC subjects. So I did the math, English, I have HSV, science, biology. I also did CAPE units 1 and 2 biology. I did sociology as well, food and nutrition, but I think currently you have to have physics and chemistry, right? Physics or chemistry to enter into nursing school, as well as the math and English. And you have to have specific grades as well. So I think 1 and 2 grades is the preferred However, if you don't have those grades, I still advise you to try because you never know unless you try. But that's what I have.
Okay, and how long is the nursing program here in Jamaica?
It is 4 years.
Registered nurse, 4 years.
4 years.
And this is, and you have, like, so you could use your C6 subjects to matriculate into the nursing program?
Yes.
Okay.
I just did the K for my own benefit, but if you have C6 only, that is fine, but you have to have the math, English, and the sciences.
Okay. Now, tell us, what is working as a nurse like in terms of what are the advantages of being a nurse? So it can't just be disadvantages, it must have some advantages, right?
I mean, for the advantages, I can only speak from a personal point of view because, you know, everybody has different experiences. It is very rewarding to help people and to help people get better and to just see the smile on the patient's faces when you help them. It is very fulfilling as well, and definitely job security is a factor and it is important because I just believe as long as you have the drive and you want to and you have the knowledge and the language, you can go anywhere in the world and have a job as a nurse. The world will never not need nurses. So that's some benefits. And just learning as you go along, because in nursing you learn continuously, you learn different disease processes, different ways to care for patients, different treatments. So it helps you as a person as well to build knowledge if that is what you want. So for me, that's some of the benefits. And I mean, I've also made my mother proud, so I like that as well.
Okay. Alright, I know that nurses have the flexibility which they can work in a hospital setting like you are doing, but they could also work in other areas. They could work at, say, nursing home, they could work in private doctor's office, they could work in a health center, etc. What are some of the main reason why you choose to work at a hospital in comparison to a health center or other aspect of nursing?
Okay.
Being a nurse.
When you're in school, right, you are trained in all aspects, so that is what prepares the nurses to be able to work anywhere. But for me, I chose to work in the hospital because I believe it will build character more for me. It will put me under more pressure, but I believe that will help me to grow and be able to work in any other condition that I am placed in. And in the hospital, it's good that you see more, you experience more, you learn how to be more hands-on and learn how to work more with less or whatever is thrown at you. So that's why I chose to work in the hospital.
Okay. Now, you know that in Jamaica, they even don't want to stick to the good side first, but in Jamaica, the patient load is high and you sometimes are assigned to more patients than you should in reality, or which is ideal. What are some of the strategies that they use to manage more patients than what is expected? Because you have an 8-hour shift and sometimes a nurse might be assigned to more than 10 patients. What are some of the strategies that they use to help maneuver those excess patient load?
I mean, it has to be priority, and you also have to just try and do as much as you can. You have to know how to prioritize your patients. So the ones who need the immediate or more attention, you try to sort those ones out first. And I'm not saying you leave anybody behind, but you have to know how to prioritize. That is how you'll be able to manage if there's a case where you have more patients than nurses. And that helps to, what should I say? It basically just like helps you to provide efficient care to each patient. But yeah, that's how I'm prioritizing my patients and their needs.
Okay. So normally at the hospital, some of the responsibilities are like doing vitals and medicating patients, right? And often that passing NG tube doing dressing. So if it's a case, and plus you have to write your notes. So if it's a case where I know you're prioritizing, but it's a case where you have excess patients, especially sometimes on some of the shifts that you might have less nurses. Do you still are you still able to give like the patients their like the required amount of attention as they should?
It
Because
can be.
sorry to cut you, because sometimes you know that some patients probably they can't move around, they can't walk, so they'll still be calling the nurses even when they're medicating. And if it's you have like say 40 patients an hour or 30 patients an hour, so in the ideal world we have the right number and the ward. But we know we have short staff plus we have excess patients. So even in the in a normal setting, say for example we don't go over capacity with the ward and we have 30 patients and like we have 2 nurses. If it's a case that one of the nurses would take like a short break, then you'll find out that you would probably end up having 1 nurse to the 30 patients. Mindful it's more, but how do you still give a patient attention that this patient is calling over there, that patient is calling over there, you have your medication to give, you have your nurse's notes to document, which you must document, alright? So how do you manage in those circumstances?
So that also comes to prioritizing and teamwork. And you also would get help from your assistant staff, right? So even if we're short staff, sometimes the nurses, work together. So if it's a case where, okay, we have this amount of patients and we have to get this done, we say, okay, you will start on the vitals, you will start on the medication. And if it's a case where the patient's calling, we will stop and go to the patient because we don't know what the patient needs, even if it's the smallest thing. We have to go and see if the patients are okay, and we still have to do our walkthrough to make sure that everybody's okay, everybody's breathing and all is well. It is challenging, and for me sometimes I don't take breaks. I just work throughout so I get everything done, because the documentation, it does take a long time sometimes, but it is very, very important. You have to document what you have done for the patient to ensure that proper care is being provided, and they are government records, so that has to be done. You ensure that your patient get their medication, the assistive staff, they'll help with like the nutritional part, the hygienic part. So sometimes not everything is left up to the nurse, but it can be challenging when not all the staff members are present, but we work as a team and we try and get as much done as possible and make sure everybody is okay and taken care of.
Okay, alright. General comment that you would like to make to someone that would want to do nursing?
I mean, definitely we always need more nurses. I just want anyone who is interested in becoming a nurse to understand it is not easy. It is very, very hard work, both mentally and physically. But if you know that that is what you want, you're willing to put in the work, you will get through. And I mean, I encourage anybody, if you want to be a nurse, do. Just know it's not an easy road, and even after you have finished nursing school, there are challenges that we face. But you as an individual and as a nurse, you just have to maintain your professionalism. You have to provide the best care as possible to your patients, no matter who they are and where they are from, because that is your responsibility, and that is your promise that you made to provide adequate care. And I mean, just have fun with it, because it can open many doors. It does provide some sense of security as well. So, yes.
Alright, sometimes because I work at a hospital, so I interact with nurses, etc. Sometimes some nurses will say to me that they feel like they're undervalued because sometimes the patient don't appreciate them enough, or sometimes the doctors look down on the nurse. Have you ever had any situation like that where you feel like you're not like appreciated enough, like the amount of effort that you put in is not?
The
Patients and doctors are not grateful for it, because I mean, doctors know that we need the nurses to get the job done, because just writing and doing general procedures, this patient's still gonna need to get their medication, etc. So a doctor work, healthcare cannot really run efficiently without nurses. That's a fact, because sometimes just writing stuff alone is not going to get the patient better. They still have to ensure they're getting the medication, getting the correct medication, getting the correct doses, right? But in terms of how you feel about like interaction with doctors and patients, do you think they are grateful enough in Jamaica?
I mean, so far, the doctors that I work with, they are very respectful and they do appreciate the nursing staff. I have not had an experience so far where a doctor was mean or belittling or anything like that. We work together and we're respectful to each other, in my experience. It can be difficult with the patients sometimes because some patients can be aggressive and hostile. However, like I said, professionalism, you are the nurse. You have to know how to deal with a patient who comes off as hostile because you cannot, give that back to the patient. You have to maintain the professionalism, you have to maintain the care, you have to be respectful to your patients. So even sometimes where you do feel like you're not appreciated, you're belittled, that the patients are mean or the doctors are mean, you just have to understand in this profession, you just have to hold your head up high and you just have to push through and do what you're supposed to do. And I mean, that's just it for me.
Alright, and a big disadvantage with nurses plus other healthcare professionals as well is that they tend not to be able to have a normal life, especially if they're working at a hospital, because then they have to work on holidays sometimes, they have to work on weekends sometimes, they have to work in the night sometimes. How do you manage to overlook that big disadvantage when compared to other jobs and still like nursing with our healthcare jobs in general?
I feel like over time it's something you get used to because even when you're in nursing school, you have to do the morning sessions, you have to do the afternoon, you have to do the night. So from nursing school, you are going to the hospital on those 3 shifts. You're going to the hospital. Only thing that we do within one holidays. But we're told from in school that you have to go on holidays. When other schools are closed for the summer, you're still going to school. So I feel like from in school, you kind of know what you're getting yourself into, and then when you start working, it's like, okay, I'm here now. I just have to know that on these special days, I might be at work. And to me, that's the life you chose.
Okay.
So you just have to do it.
Alright, so how does it the type of job that you have being a nurse affects like your family life? Because most often than that you probably have to miss out on some family occasion happening sometimes. You miss out the quality time with family because especially if you are the only member of a family with healthcare, being a healthcare worker at the hospital, you will basically be looked at as the one that is been missing most of the time. How do you manage to deal with that aspect of family life in terms of missing out on some of the important events?
I mean, for me personally, it doesn't affect me that much. Sure, there are some events that I might not be present at, but my family understands and they know the importance of my job, and I might not be present at every event. And I mean, for them, they are so proud because my sister, she tells everybody, oh, my sister's a nurse. My mom, my daughter's a nurse. So it doesn't really affect us much because they understand the importance of my job and what I do.
Alright. Now, other disadvantages of healthcare working, they are exposed to a lot of viruses, bacteria, and diseases overall. Especially the nurses tend to spend longer hours close contact with ill patients, I must say. Alright? How do you manage to prevent picking up viruses, bacterial infection regularly and still doing your job effectively?
Well, that is why we are taught standard precautions from you're in school. So you're taught that if a patient comes in, rather if they're new or if it's a patient that is known to the hospital, you wear your protective equipment, your gloves, your face mask, your gowns, because you have to protect yourself because obviously if something happens to you, you can't take care of anybody. So every nurse, we are taught that standard precautions, whether the patient is infectious or not, you have to maintain that to protect yourself. And I mean, it can be a little scary sometimes because we are on the front line, everything reaches us first. But like I said, these are things that we're taught beforehand. So you kind of prepare yourself, you do your research, so you know this disease is transmitted this way, I can do this to prevent this disease from affecting me. So I mean, that's one way to do it, but yeah, that's what we were taught and that's what we know.
The experience that they have been a nurse. Memorable experience, fun experience, fulfilling experience in terms of saving lives, patient being grateful. That's one of the cases that you can remember that you really feel accomplished managing.
I mean, from when I was in school, I've had several patients who have expressed their gratitude to me and their relatives also, saying that I took good care of them and I was so nice to them and respect and they really appreciate that. And for me, honestly, just somebody looking at me and saying, thank you for helping me or thank you for taking care of me, it fills my heart a lot, honestly. Like, it really makes me feel good to know that I made a difference in someone's life. So that for me is a big plus. So, I mean, for the most part, just helping people and helping, they appreciate it, they really helps.
Okay, so what are some of the sad moments that you have so far being a nurse, like real bad days? Example of some real bad days that you might have had. Whether with patients or with colleagues or just keep it general, I guess.
Yeah, it's just sometimes when, sometimes the patient, they might not have made it through and that is sad a lot of the times. Because, you really wanted them to make it through and get better and sometimes they don't. So it can be, heartbreaking sometimes because really, for me, you do have some patients who really touch your life and it makes a difference when it's, things just didn't work out in the best way. So.
Okay. As we discussed here on this channel, life of a registered nurse in Jamaica, we could have gone all day, we could have gone all week, but I guess we're just giving you a summary of what it's like, so we don't get in any trouble, alright? So thank you very much for having this interview. I know you're a bit scared, but I hope you don't get in any trouble, alright? So guys, remember to share, like, subscribe and leave a comment on this video, and in the comment section I guess you can go ahead and share your experiences with nurses and the good stuff and the bad stuff that persons who are interested in becoming a nurse or in the medical field can have an idea of what they are getting themselves into. So it have both advantages and disadvantages, so at the end of the day it depends on what you make of it. Alright? Thanks very much for tuning in today. And
Be sure to subscribe for more informative contents on life, sickness, and death.